But a couple months ago, I told you guys that I had PCOS, and in fact, come to find out, that is actually not what I have. I got misdiagnosed.
During those times, I saw a lot of doctors who kind of brushed me off and told me, oh, you just have PCOS, you're just depressed, get on antidepressants, you need to go on a diet and lose some weight. And they would just always like try to prescribe me birth control pills as a solution. And
Okay, good evening, everybody. Welcome to the new edition of the Good Hormone Health webinar. Today's talk is entitled Growth Hormone Deficiency, PCOS or Cushing's. How do you tell them apart?
Hi everyone, I'm Jane. In this video, I'm going back a little bit to my origins of why I started a YouTube channel to begin with. And I'm inspired to do that because Dr. Theodore Friedman uploaded a YouTube video this week that I really want to promote. And it's about distinguishing between Cushing syndrome, growth hormone deficiency, and PCOS. And I've had 2 out of 3. I've had Cushing's, and I am being treated for growth hormone deficiency at the moment. And it's the origins of my channel is because people are getting misdiagnosed. This first gal was being treated for PCOS, and she insisted on pursuing it further and found out she has a prolactinoma and is being treated for that. And this second gal was being treated for PCOS and insisted on getting a further workup, and she turned out to have adrenal Cushing syndrome. Now, I have had adrenal Cushing's, and I'll just share my pictures. It's almost to a point of embarrassment. The picture on the left is in 2006. I was not a skinny mini, but as you can see on the right, I gained a tremendous amount of weight. It was 40 pounds, but it looks like 140 pounds. And this was due to adrenal Cushing's. I was just scratched my head for a long time, like, could menopause do this? Anyway, here's a current picture of me. That is from the last year or two, I forget exactly. But even with the growth hormone deficiency, I've slimmed down. In regard to Dr. Friedman, he has a really good outline about the symptoms of each illness, and it really points out the importance of getting an accurate diagnosis. Um, and part of my motive with this channel is that, dealing with really lazy doctors, or they're like a deer in the headlight, dealing with unusual illnesses. And it's just so important to get an accurate diagnosis. I am not a big fan of healthcare, especially with really doctors that don't do the job they signed up for. So that's why I want to do this video again today. I'm going to follow it by, after I do a couple clips of Dr. Friedman. I really urge you to watch it if if you've been have symptoms of PCOS. It very well could be growth hormone insufficiency or Cushing's, and especially in regard to growth hormone insufficiency, uh, a very decent percent of fibromyalgia patients actually have it. So there's another reason I, really encourage people to get a decent endocrine workup. There's a little variation. Dr. Friedman's from the LA area, and I would suggest he comes highly recommended. I have a really good doctor in the Phoenix area. Get in touch with me. I could provide his name and, contact information and that. Where I had the adrenalectomy for Cushing's is out of network, but that would be another resource. And, there's some variation, and they're both really good doctors. But for example, Dr. Friedman uses either a MacLeod stim test or a glucagon stim test to diagnose for the growth hormone insufficiency, and mine was done using a clonidine stim test, and they're all valid. But okay, I'll play some clips of Dr. Friedman and share a chart and pause a moment again there. Okay.
It affects over 7 million women. That's more than the number of people diagnosed with breast cancer, rheumatoid arthritis, multiple sclerosis, and lupus combined. PCOS affects multiple parts of the body. So my approach is to tackle all three. We do the Cushing's testing, we do the pituitary MRI, we get the Biovel and total testosterone DHES to look for PCOS. I treat the PCOS with either supplements or the pills. We measure the IGF-1 and it's followed by a growth hormone stimulation test. If you fail the growth hormone stimulation test, I would treat you with growth hormone, and hopefully one of these things will cause the patients to improve, or it becomes clear whether they end up with Cushing's, PCOS, or growth hormone deficiency. So this is a table that I created that tries to show the different symptoms in the different diseases. It's not foolproof, but I think it gives a good idea. Weight gain is more common in Cushing's, middle common in growth hormone deficiency, and less common certainly occurs in PCOS. Irregular periods are more common in PCOS, less common in growth hormone deficiency, in the middle in Cushing's. Daytime fatigue is quite common in Cushing's and growth hormone deficiency and occurs but less commonly in PCOS. Acne and facial hair are most common in PCOS and Cushing's, less common in growth hormone deficiency. Hair loss is common in all of them. Poor sleep can occur in all of them, but it's more common in Cushing's. Joint pains is more common in growth hormone deficiency, but can certainly occur in Cushing's and a little bit in PCOS. Depression and mood changes are more likely in Cushing's, but can occur in PCOS and growth hormone deficiencies. And infertility is more common in PCOS, can occur in infertility, and then can occur less likely in growth hormone deficiency. So this is a guide on your symptoms, but you definitely need the testing to see which of these buckets you fall into.
I was pretty tickled to see that this chart he made comparing the symptoms of these different illnesses. And this is a picture of a homemade chart I made some time ago. I could provide the link to the video. But mine is a little bit different. I have hypothyroidism on there, and also metabolic syndrome. And it could be the male version of PCOS. With the high lipids, the high blood pressure, the belly fat, that kind of a thing. And PCOS will have metabolic syndrome, so I added that to the list. But as you can see, the crossover is tremendous with all of these endocrine problems. And there's one symptom I want to mention that Dr. Friedman does not put emphasis on, and and it should. He talks about joint pain. Well, there can be a lot of muscle pain with Cushing's and growth hormone insufficiency. And as these illnesses progressed, the body aches were just off the charts. beginning with Cushing's and even worse with growth hormone insufficiency. If you could imagine having the worst kind of flu and the kind of body aches you have, well, multiply it a few times. It's very intense. Another symptom with the growth hormone insufficiency, and I think it may play a role in the weight gain with it, is the GI tract, the motility slows down. So you really lose your appetite as time goes on with that. And growth hormone insufficiency is nothing to toy with. I mean, as it progressed, I had to stop driving. I couldn't trust myself anymore. I mean, I'd freak out if a squirrel crossed the road. I would so over respond, to like a big adrenaline rush, that type thing. And I was essentially became bedridden. It's really awful. And next, I am going to play an old video of mine, and this really ties into the pain factor and why I got interested why I got interested in fibromyalgia and how these people are not just falling through the cracks, but I would suggest getting pushed through the cracks just from my own experience and looking at the literature of fibromyalgia. And this video was time consuming because I heard people's stories, and I don't mean to make light of anybody's suffering, but it's like pin the tail on the donkey. Can you guess what their medical problem is? Have a good day, everybody.
When you hear hoofbeats, think of horses, not zebras. Dr. Theodore Woodward. In the medical world, the term zebra is slang for like an unusual or an exotic diagnosis. And zebras. There it is. It's my kissing zebras theory for life. Okay, that's what we're calling it.